This is the video tutorial for the great free senior marketing tool called Social Service Checkup. What is Social Service Checkup? Well, it's a web-based tool that can be accessed anywhere there's internet. It gives you the ability to look up money-saving assistance programs for seniors. Their slogan, connecting people with the programs designed to save them money. So how does it work? Through a series of brief interview questions on home, personal, financial, medical needs, a report is generated. The customer can choose what programs they're interested in. You can then print them out for them or email directly to them. You look like a hero in your community when you're showing seniors how they can save money. Where can I use the Social Service Checkup tool? Well, this is outside the guise of CMS and Medicare, so you can use it anywhere. Formal meetings, informal meetings, senior health fairs or gatherings, let your mind go wild. It can be as its own event as well. Social Service Checkup will make you a hero in your prospecting territory as you bring valuable information to the seniors there. Make sure you're using your Social Service Checkup tool to promote your community meetings on Medicare Advantage, Medicare Sup, Part D, and Special Needs products. Now let's just take a minute and take a look at a video that I'll be able to walk you through the online tool and show you exactly how to do one of these Social Service Checkups. Take a look. We were talking about earlier. The website you want to go to is https://checkup.sscincorporated.com. It's a very simple tool to use, and it does extremely well when you're out using this in a formal or informal setting or into a senior health fair to let these seniors know what services and money-saving programs are available to them. All you do is hit Get Started Now. There's several just little questions you need to ask to be able to print them a report to take home, make yourself look like a hero. There's a Household tab, a Personal tab, Financial tab, Lifestyle tab, and Medical tab. You put them all together and you come up with a nice report. So we'll click on Home State, and here we'll go to Ohio. Put in the county that you want to be working in, or their county, of course. I'll say Claremont here. And what's their living status? Do they own their own home? Do they rent a home, live with family, etc.? We'll say here they own a home. Give a date of birth for the person that you're doing the program for. We'll say August 23rd. And we'll say 1923. Are they married or are they widowed? Is there anyone age 18 or under living with them? You click Next, you're done with that part of the program. Personal? Are they enrolled in Medicare? Yes. Are they enrolled in Medicaid? Or if you're not sure, you can click Not Sure, if they're not sure. And here's the little question tabs over here to tell you exactly what you may need to know in case you get stumped. We'll say no, for example. Do they receive Social Security income or Social Disability income? We'll say yes. Are they a veteran of the U.S. Armed Forces? We'll say yes. And we move on to the financial part of the program. Are you employed? We'll say this person is not employed. What's their monthly unearned income? Here's going to tell you. You're going to include Social Security or Part D premium, pension, VA pensions, etc. So here we'll put in $1,500 for this example. Total assets. You'll see that includes life insurance, checking accounts, savings accounts, etc. But it does not include their first home. So here on assets we'll put in $50,000. Let's say they have a life insurance program. Lifestyle. They're going to want to know who their energy provider is. We'll say Duke Energy for the electric and the gas. Telephone provider, we'll put in Cincinnati Bell. Cellular provider, we'll say the provider is not listed. Are you interested in food programs, Meals on Wheels, etc.? We'll say yes. And it'll tell you right here what kind of programs we're talking about if you have a question on that. Click Next. It's going to ask you medical. Would you like help with your medications? You say yes, and it's going to ask you specific questions to medications for medical conditions that may have some situations that could help them. We'll say cardiovascular disease, prescriptions for pain. We'll also say respiratory. Submit. And what's going to happen here is it's going to pull up a report for this person. And you're going to be able to scroll through this report, and you're going to be able to discuss with them the different programs that are available, and then print them off a customized report of the programs they might be interested in. But over here gives an example. There's 140 programs that are available for this particular individual that go everywhere from energy all the way to grant and income replacement services. So it's very interesting how this works. But we'll say home energy here. We can click on housing assistance, and you can see you can scroll down to different programs. You may ask a question about the potential monthly savings being zero. That part of the program is not built out yet, and so they don't want to do any kind of guessing on monthly savings at this time. When you pick the programs that you want, whatever they may be, there's even parts in here for recreation, transportation, whatever, you can print those selected programs, and you can hand it to them right there with your business card. This will really set you apart in the field. It's going to make you a valuable resource, whether you do this in a formal or an informal setting or a senior help fair. What's coming very, very soon is the ability for you to personalize this with your own agent name. And you can also see you can email those programs we just selected to the person if they don't want to have something printed. Well, that's it. I hope you enjoy the social service checkup. I hope you use it as a prospecting tool. This is Scott Nichols with S.A. Nichols Brokerage, wishing you good luck and good selling, and use the social service checkup to make more sales. Thank you. There is more marketing video training available on this page. The Community Meeting Seminar Prospecting Program, other presentation do's and don'ts for Medicare Advantage plans, Part D, and special need products. Also, there's information on here about how to properly use the Agent Toolkit so that you can create the ARP advertising and marketing pieces you're going to need to promote your community meetings. Also, check out the video on the powerful prospecting tool of the Social Services Checkup. This is a great way to meet more and more prospects and bring them valuable information that they need. Have questions or need advice or just want to discuss the community meeting program? Call us at S.A. Nichols Brokerage, 800-283-0040. You want to schedule an event? Call the United Healthcare Producer Help Desk at 888-381-8581. This is Scott Nichols, President of S.A. Nichols Brokerage, thanking you for your time today. Now plan your work and work your plan. Good luck and good selling.